The hip joint is a ball and socket joint, that is the point of articulation between the head of the femur and the acetabulum of the pelvis. The hip joint connects the lower extremities with the axial skeleton. It is a type of synovial joint that connects the pelvic girdle to the lower limb. The adult os coxae or hip bone is formed by the fusion of the ilium, the ischium and the pubis. The hip joint is the articulation between the ellipsoid head of the femur and the hemispherical concavity of the acetabulum located on the lateral aspect of the hip bone. The femoral head is covered with articular cartilage, also called as hyaline cartilage, with the exception of a rough central depression, the fovi capitis. The two hip bones form the bony pelvis along with the sacrum and the coccyx and are united anteriorly by the pubis symphysis. The acetabulum is formed by the fusion of the ilium, ischium and the pubic bones, and it plays a significant role in the stability of the hip joint as it almost entirely encompasses the head of the femur. The acetabulum contains semilunar region, also known as lunate surface, that it is covered by articular cartilage. The hip joint is enclosed by a strong fibrous capsule and lined internally by synovial membrane. Being a ball and socket joint, the hip joint permits movement in 3 degrees of freedom, that is flexion, extension, abduction, adduction, external rotation, internal rotation and circumduction. The muscles of the hip joint can be grouped based upon their functions relative to the movements of the hip. Muscles which helps for flexion are psoas major, psoas minor, iliacus, pectineus and rectus femoris. The extensor muscles are gluteus maximus, semitendinosus, semimembranous, biceps femoris muscle. The adductor muscles are adductor magnus, adductor longus, adductor brevis, gracilis and pectineus muscles. The abductor muscles are gluteus medius and tensor fascia latae. And the muscles helpful for internal rotation are tendon fascia latae and gluteus minimus muscle. And the external rotators are gluteus maximus, gemellus superior, gemellus inferior, obturator externus, obturator internus, quadratus femoris and piriformis muscles. So these are the muscles of hip joint. The main nerves in the hip region includes the femoral nerve in the front of the femur and the sciatic nerve at the back. The hip is also supplied by a smaller nerve known as the obturator nerve. In addition to these nerves, there are blood vessels that supply blood to the lower limbs.